not do well are smokers, they're diabetics. So if you could say, if there's any time you can quit cold turkey, this is it. You know, there's so many jokes and memes about how we're going to get fat during this time, but we can really take this time to be our best self. Be like, you know, all these years I've been wanting to get healthy, this is the time. So stop snacking. When you do go to the grocery store, buy the hopefully not everyone will get it, and if we make good decisions, wear your private.
Okay, and this is Dr. Babu, but both doctors could answer this question. Do I need a test? If I don't feel well, do I need to get that test right away? And then are there tests available that could say whether you had it or not?
Sure. I don't believe everybody needs a test. The effort to go out and get the test, if you don't have it and you go to the place to get the test, you might go get it when you're there. That being said, that's assuming that you are willing to act like you have it. So stay in place, shelter in place. If you are the type of person that you're only going to follow the rules if you know you have it, then yes, go out, get the test. There are places to get it. Don't come to the ER, but go to, you know, there's the drive-through places. The other countries are testing everybody because, like I said, those countries can then put a strict quarantine on those people. But if on everybody that has it, but because we don't have those types of rules, we don't really need to test everybody. We just need everybody to stay home.
Yeah, I think the focus is more on beating the virus than preventative at this point. You know, a lot of times when we do the testing, it's more of, okay, this person is COVID, you know, like you know, Dr. Lalani said, it's about quarantining them or putting them in negative pressure rooms and so forth, which is done. I mean, you have other countries who are tracking them on cell phones. And, you know, we don't have that draconian type of methodology in the United States. So right now, I mean, the test, yes, is an important test. It can be, but, you know, when we're thinking about it, if you're having signs and symptoms, first thing is to stay and help yourself, you know, not run into the emergency room, because even right now, there's just so much patients who are in severe need of, you know, severe pneumonia. And I'm sure, you know, Dr. Lalani will tell you the mythology there is saving lives. It's a virus. It's not like bacteria where if you have a strep throat and, you know, you take a Augmentin or you take an antibiotic, it'll go away. You know, virus has a lot to do with you fighting it, your immunity fighting it and combating it. So, you know, it's important in your way of preventative is, you know, taking care of your health, taking care of, you know, the supplements, making sure you drink, you know, Pedialyte water, whatever it is that you need to do, and fight it out. You know, and that's the most important thing. The test is just more of your, you know, mental security of what it is. But at this point, you know, fight it, because you're better safe home than going into a hospital filled with COVID.
Absolutely. Absolutely. So I've read that there are some places like in Mount Sinai or some hospital in New York, they're doing plasma type of donations from people who have survived and are feeling better and have some type of antibody in their system. Could either of you speak to that program that's happening? And again, anyone who has questions, please put the questions in the chat area, chat box of the screen.
I did hear exactly, like Bindu said, this is a virus. There aren't antibacterial antibiotics out there to fix this. So right now there's a lot of trials for a lot of different medicines, azithromycin, Plaquenil, that we're generally trying to save for the people that are in the hospital who are really, really sick. And I did hear that, you know, Mount Sinai is doing it. They are so overwhelmed themselves that they're actually like, there isn't space for us to even send patients from Northwell there. But I do hope that in the, you know, in the coming weeks or days, that means we'll all start be doing it as well.
Dr. Babu, we are in Queens, which is the most diverse place in the entire world. And we've seen and heard that our hospitals have been inundated more so than the rest of the city. Why do you believe that is the reason behind Queens getting more than the average? We have 67,000 people who've been diagnosed, and I believe over 24,000 have come from Queens in New York City.
I mean, that's more of a personal theory of mine. I mean, there's no studies or anything yet that why would Queens have it more. But I do believe that, you know, Queens is a diverse, you know, community, and we have the entire subway system, you know, and unfortunately you have people who are asymptomatic, and if they're running around in the subway system and they don't know and they're not aware, it's sad, but it spreads. And you're talking about a virus that's in the air for 3 hours alive. You know, so it's an unfortunate situation. You know, we can't see viruses. We don't know who has it, and it spreads. And I believe a lot to do with the subway system. It was kind of caught us out of guard, and a lot of preventative measures weren't put in place due to that. But it's important now to understand that, you know, we are aware. We have great people who's, you know, out there in the front line helping and fighting and really, really trying their maximum and worn out. So what we have to kind of do now, and, you know, CDC is also recommending it at this moment, is covering our face the best way we can. You know, go out there, cover your face, make sure you wash your hands as every time you can. I mean, there's certain studies, again, everything is still in the air. I mean, the virus supposedly alive on metal for 24 hours. I mean, there's so many things out there. But bottom line, whether it's alive for 24 hours, 10 days, wash your hands. Constantly wash your hands. If you're an essential worker and you're on the subway system, wear a mask or cover your face with a scarf. Do what you can do now to help yourself and help others.
Hey, I'm so sorry to interrupt, but I have a question. If you're wearing a mask, can't the virus still get onto the front of your mask? And people are saying that you can inhale the virus into your mouth from the mask. Is this true, or is that wrong accusations?
The virus is it's living, and what we can do is the best way at this time is to wear and prevent as much as we can. If you are a person who cannot stay home, and you have to be out there in the front line, or you are an essential worker, the best thing you can do is cover your mouth, regardless of, I mean, whether the virus is on top of the mask or sneaks in somewhere. I mean, if you sit there and mentally start worrying about all these small, minuscule possibilities, you're going to be afraid. And and what we're trying to do is gather up as much strength that we have to fight this.
Yeah.
You know, regardless of, I mean, I understand your fears on that, and we don't have enough studies right now, but what we can do is cover your mouth, you know, and I'm sure Fazila can add to that.
Can the virus get into your eyes and your ears as well, or is it just your mouth and your nose?
It can get into your eyes. That's what they say. Don't touch your eyes, even though I keep doing that. I just wash my hands beforehand. But I say don't touch your eyes because there's mucus in your eyes as well. You know, you're just constantly trying. There's no guarantee. Even what you said about the mask, there's nothing in the world that's a guarantee. But you're definitely going to decrease your chances significantly. If you sneeze or you cough, if you have that mask on, you're protecting everybody around you from your particles getting away. So even if it's not 100%, it's got to be at least 90%, significantly decreased.
Okay.
To go back to the question from before, another reason I think it might be Queens is because there's so many multi-family homes in Queens. Multi-generational, you know, from great-grandkids to grandkids, to stay 6 feet away. And you can't say, okay, grandma's going to stay in another apartment. We try to tell families, you know, can you get an Airbnb? But it's, you know, also financially, it's not something realistic to say, okay, let's move Granny to another house. I think that adds to what makes it really hard in Queens. So we just gotta try harder.
Okay. Well, thank you for doing this meeting. It helps a lot to people out, you know, to ask questions and stuff and get the information, because some people don't know at all. Like, I live in Pakistan, and there are people that just don't care. Like, You see, in America, the streets are empty, and in England and the UK and stuff, and in Pakistan, there are like hundreds of people out there don't even care, and my country is infected very badly at the moment.
Sorry to hear that. It's a trying time for everyone.
I know, because in Pakistan, like all we care about is like selling belts and hats and stuff on the street.
Yeah, we're focused right now on Queens. And is there anyone else in the town hall that has a question for one of the doctors?
We've got some questions in the chat, actually.
Justin, can you ask one or two of the questions from the chat box, because it disappeared from my screen? I'm new at Zoom as well, so
I can call it out for you if you'd like.
Yeah.
Yeah.
Justin, if you could start, ask one of the questions, please.
Yep. So our first question was, if someone tests positive for COVID, how long after they feel better are they still contagious, if at all? And can you develop immunity to this if you recover 100%, or can you catch it again?
So you should stay home, you're contagious, until 3 days after your last symptom. So suppose you're coughing, feverish chills for 10 days, then you have to be home for 3 days where you have no fever and you don't need any like Tylenol or Motrin, and then you can go home. So on day 14. But if you had symptoms for 17 days, then you might be day 21. Your cough doesn't have to be completely gone, but it should be better. But everything else should be gone.
Can you please put that on mute if you're coughing so that everybody can hear? I'm sorry.
Wear a mask.
Yeah,
and then to the other question, we don't know yet. If you can get it once or you're going to get it again, unfortunately, it's too soon. We don't know yet. They're starting to try studies, but we can't say yes or no yet.
You know what? I just wanted to add. Not add something. I saw that chat. I get half the chat, half not. But there was somebody had mentioned this, and I also get this with my clients. Is celebrities, athletes, the well-connected, and even animals have no problem getting tested for COVID. For the rest of us, testing is not available. What can be done to level the playing field together? And right now, and more of a mental point of view, it's a very frustrating time for everybody. It's like I said, this has come out of nowhere. This is very surreal, and we have everybody working round the clock doing the best they can. And at this time, if we sit down and focus on celebrities and athletes and propaganda and who gets tested, who doesn't get tested, all you're doing is hurting yourself and getting angry. And right now, it's only going to disturb you, your mental peace. Ask me how come a celebrity gets it. Is it a financial influence? Is it a political influence? I can't even answer that. I wouldn't know. There must be some parameter there that we don't know. Maybe it's just the fact that they were super sick. We can't tell you that, right? I'm not them. We're not them. But my advice for you on that is, yes, we have a media that puts so many things out. It's unfortunate, but right now let's come back down and stay grounded to the fact that, hey, you know what? That test at this time really isn't going to help you. It's not. Whether you're tested positive or not, you have to stay home. You have to beat it. You have to fight it out with your immunity. You need to take the supplements. You need to stay hydrated. And if it's extreme severity where you have severe shortness of breath and you just know it's going in the wrong way, that's when we're going to go to the emergency room and do what we have to do. Whether you're tested positive, at this time, 70% is positive, 30% is false. There's just so much behind this test. But if you're sick, you're sick. You got to fight it. So let's not focus on the positives, the negatives. Let's work together in healing. This is my biggest advice for you.
Thank you, Dr. Babu. I would like to ask Dr. Lalani, first, you have such experience working in third world countries. You worked in Tanzania and Africa, and I know you're working now harder than you worked there. Can you explain what it's like for you when you go into the Forest Hills Hospital, to the emergency room? How is it different today than it was a month ago? And do you really believe March 1st was the first case, or do you think that New Yorkers were exposed a lot earlier than March?
Much earlier, I think, anyways.
Yeah, I do think that there were probably cases beforehand that we just didn't know about, we weren't testing back then, and we weren't even thinking about it. And I think that's why there's a much big spread. A lot of the health workers that are sick, they were all exposed very early on. So it must have been that it was there and we didn't know about it. It's hard. Work is a totally different place now. So Forest Hills usually sees about 150 patients a day. Now we're seeing 250 patients a day. We've had the kindness of the other doctors in our Northwell system that every day we have almost 4 to 5 extra attending physicians working a shift for us, with us. So hand in hand, yesterday there's 7 of us when usually there's 2 or 3. But that's great because we're able to see patients quickly and go through the 250 patients. Initially, about 100 of those patients were really what we call worried well. So very few symptoms. Maybe we just had to educate on taking what I said earlier, Tylenol, Pedialyte, gave some prescriptions for albuterol inhalers, encouraged people to drink even if they didn't feel like it. So thankfully over the weekend, I've noticed that number has really decreased. I think we're really getting the message out there. Don't come to the ER if you don't have really significant shortness of breath. But people with shortness of breath, this disease is wild. Like, people can get hypoxic, which means low oxygen, and be sitting there comfortably and their oxygen's in the 80s. And we can't explain it. Anybody that's oxygen is below 92 and it should be 100, we admit them to the hospital. So a lot of people getting admitted between 92 and 88 just for low oxygen. They're going to be kept in the hospital, put on some medications, watched, and hopefully discharged. And then there's some really sick patients who we have to give all the oxygen we possibly can on an oxygen mask, and they still are not keeping their oxygen saturations in the 90s, and so we have to put them on a ventilator. And I've put more people on a ventilator this week than I have done since I started training 10 years ago. And it's really hard, and so that's what I was saying earlier. Stop smoking now. Eat better now, because those are the things that are going to make you at a higher risk for getting it badly.
What do you think about vaping and Juuls? Is those still bad?
So totally bad. Stop. One of my first patients with coronavirus was 29, and he told me he had no medical problems. He got admitted. He's 29, and we had to put him on a ventilator. We intubated him, and I was reading about him a few days later, and he vaped. I asked him, did he smoke? And he said no, because people don't think vaping is smoking, but it definitely is. But at 29 already, your vaping can be ruining your lungs, where you're not going to do well with this disease. So I hope the Juul stocks crash, because vaping is awful.
I have a question for Dr. Bindu Babu. When do you think the virus is going to come to an end? Do you think it will come to an end by summer, or will it be after summer?
The faster people stay home and sacrifice, the faster the virus will come. Unfortunately, none of us are God. We're all people here trying to do the best we can. But believe me, that makes such a significant difference staying home. We have to stop the spread. I know it's difficult for everyone. I'm such an active person. I've never, ever stayed home like this in my life that I can even remember. And it's tough. But I take this time to say, hey, this is my part to stay home. I'm also an example to stay home. Let's find different ways of keeping ourselves busy. I mean, thank God, a lot of local businesses are doing free yoga, free meditations. I'm doing free meditations on Facebook. I've been, so many people are doing dance classes, and there's so much Zoom and different opportunities to take this time to better yourselves or do things you've never done before. Pick up a book, read a book, catch up on Game of Thrones, whatever it is that you need to do, keep yourself busy. I have said so many, it's interesting, like I'm sure many people can resonate this with me. I always say, I never have time for this, I don't have time, I don't watch TV. And now I'm getting the time, I should not complain. Like, let's try to kind of sit down and utilize this and embrace our life now, instead of thinking about when is this virus over, when is it. Let's do our part. Let's stay home, and let's stop the spread, and then the virus will go away.
Thank you, Dr. Babu. That's very encouraging. We have a lot of time on our hands now, so it's good to take up hobbies and enjoy it as much as possible, and not to be stressed out. Easier said than done, but there were some people who were really able to take advantage of the time, which is good. Justin, do you have any other questions that have come in that we haven't been able to post to the doctors yet?
Yes. Someone just asked if the Elmhurst area is still the epicenter for the Queens virus, the Queens area.
I saw that it's not just Elmhurst. I saw Forest Hills. I saw Rego Park. It's been a couple of days since I saw those stats, but it was there was an article that broke down Queens, and I remember seeing Forest Hills and Rego Park, and there was about 5 different areas. So I mean, Queens is Queens. We're all within seconds of each other. So I wouldn't say, oh, Elmhurst is sick and I can walk outside my house. I would still say I have anywhere you are. It's not just Queens. I mean, it's in Long Island, it's in Forest, it's in Brooklyn, it's in Manhattan. It's anywhere. It's upstate. It's all of New York, but so it's not just Elmhurst for sure.
Do you think Boris Johnson is going to be okay with the virus?
The last I heard was he was in intensive care in NHS in England. But, right now we're focusing on, Queens and how we can help together as a community, to beat this virus.
But Dr. Babu, that's a good point. People have been saying, I've seen a lot on the internet, poorer communities, more disadvantaged communities are getting the virus at higher numbers. And that is true, and we must be sensitive to that and try to prevent something like that from happening to communities that are more socioeconomically depressed than other communities. But here you have a prime minister of a country in England that he's come down with the virus as well. So to your point, Dr. Lalani, it does not discriminate no matter how much money you have, your socioeconomic status, or where you live. This virus can get to you. So we must stay safe out there and follow the guidelines of wearing a mask and keeping our hands clean. Justin, we'll do 1 or 2 more questions before we wrap up. Do you have any other there that we haven't addressed yet?
Yeah, someone is asking.
Yeah, I would like to say that my doctor gave me advice to stay at home. So if everybody could stay at home. So
thank you. We're going to try to get a question from somebody who hasn't asked their question yet.
Yeah, someone is asking if the Queens Hospital's inventory level of respirators and other related supplies are adequate enough to deal with the cases that are coming in.
So at Barstow, we've transferred 300 patients in the last week.
Wow, man, that's a lot of patients.
Yeah, we're a small hospital, and thankfully we have a really big Northwell Health system. So we've taken a whole internal medicine floor and made it into an ICU. So we have 3 ICUs in a hospital that only had 1 before. But no, that's definitely, if you could write to the, let the world know. I think the world knows there's not enough ventilators, and we definitely need more.
But it's good to know, Dr. Lalani, that if somebody is experiencing COVID and they're in your hospital, and if your hospital cannot care for them, that right away they're going to be transferred somewhere where they'll get the care that they need.
Yeah. I was texting one of my patients. I see another question about the azithromycin and hydroquinone. So
That's a good question, yes.
A patient of mine, we're not allowing any visitors inside the emergency department because to protect the patients and the visitors. So I've been calling, especially this one patient I had to intubate, would put him on a ventilator. So I called the daughter from my cell phone and I let them FaceTime. And so I've been in touch with the daughter, and she asked me about the azithromycin and hydroxyquinone. And she was saying, I need to get it. And I said, why? We're giving it to your father. She was so worried that we weren't giving it because she's heard about shortages. And I said, I promise you, your father is in an amazing hospital. He's going to get all the care that he needs. He's going to get the medicines he needs. There is, it's too early to say if there's improvements with azithromycin hydroquinone, but we can say probably, because that's why they're improving the test, allowing the test. But just the biggest thing right now is to have faith that we're going to get, if you do it, you're going to get better. If you believe in God, pray to your God and every God right now. Get close to your family, talk to your family on a regular basis. And I really believe in start making good karma, start trying to do something, make a project that you never had thought about doing before, and just start developing your own good karma, and just have faith that you're going to, help other people. And when we're all out of here, start volunteering at the nursing home or something. But I think that this is all about us becoming stronger people and having faith in either the Lord, or having faith in, just humanity, that we will get better, we will get through this. And just trying to stay calm and not go crazy.
Yeah, I agree. It's really, like I said, don't get too, go into the COVID positive and the testing, and, understand this is a virus that doesn't, no race, no gender, no nothing. Just as Dr. Lalani said, this is about us being in touch with, whatever God you believe in, being strong, doing our part, and staying home.
Thank you so much, Dr. Babu. Thank you, Dr. Lalani. We're all doing our part. We look like we might be flattening the curve now that we heard the governor say for 2 days we hadn't seen an increase in the number of deaths, not a drastic increase, and it seems like we've plateaued in the number of new cases. Would you agree that we've seen some progress, and potentially maybe these new medicines are helping keep more New Yorkers alive with this virus? I think that's happening.
I've been working nonstop, so I haven't been looking at the stats, so I'm happy to hear that. If that's the case, I hope that's the case.
Thank you, Dr. Babu. Can you give us your Instagram or your Facebook address so we could participate in some of your meditations and other ways of keeping us holistically well during this trying time?
Yeah, it's all about mindfulness, living in this moment. That's what we have to do. That's what we can do. We can't think about tomorrow, what's going to happen. We have to structure us today for tomorrow. So my Instagram is Dr. Bindu Babu. That's DrBindu Babu. It's the same as my Facebook and Twitter. I do the meditations. I do a lot of mindfulness speaking during this time, and let's all work together on this one.
Thank you, Dr. Babu. Dr. Lalani, if we want to help, is there ways we could help the workers? You are our heroes, both of you, Dr. Babu and Lalani. Is there ways that us New Yorkers can give back to say thank you to our emergency healthcare workers?
It would be amazing if you could help get PPE, like donations to. On my Facebook, there's a residency program in the Bronx, the Jacoby Hospital residency program, and that they're trying to raise money to get money for masks and gowns and things like that. So that's probably the best way you can contribute right now.
Thank you. Yes, great. Thank you, Dr. Lalani. I think we're going to wrap up tonight's town hall. I really can't thank you both enough for the work that you're doing. You are heroes. You're keeping New Yorkers alive during this very difficult time. I want to thank all the participants. Thanks for bearing with us in our first Zoom/Facebook town hall. We're sorry we had some difficulties starting out, but we're going to work them out just in time for our Zoom/Facebook town hall next week. Next Monday. Please join us again back for a town hall on Monday. Remember, if you have any good ideas, please send me an email on topics. If there are any questions that you had tonight that did not get answered, please also send me an email or post it on Facebook, and we'll do our best to get answers for you. Thank you. Have a good night, everybody, and stay healthy. And give a round of applause to our doctors. Thank you so much. You are the best, the very, very best. You represent the best of New York and Queens. Thank you. Have a good night. Bye, everyone. Hope to see you soon. Bye-bye.